மதன் சார் குட் ஈவினிங். உங்ககிட்ட பிரேயர் இருக்கா? ஸ்ரீ பிரியா வரலையா? உடம்பு சரியில்லையா? அருள்பாரி சார் வந்திருக்காரு, பிசிஷியன் பிரேயர் அவர் சார். வணக்கம். பிசிஷியன் பிரேயர் வச்சிருக்கீங்களா? ஐஎம்ஏ பிரேயரும் பிசிஷியன் பிரேயரும் வச்சிருக்கீங்களா? அன்மியூட் பண்ணிக்கோங்களேன். ஹாய் மஞ்சுளா மேம், வெல்கம்.
Hi,
just give me 1 minute. I'll get it.
Yeah. Thank you for coming. மதன் சார் என்னாச்சு? பேக்ரவுண்ட் வரலையா?
பேக்ரவுண்ட் ஆட் பண்ண வரல.
வணக்கம் மஞ்சுளா மேடம்.
அருள்பாரி சார் வச்சிருக்கீங்களா பிரேயர்?
வணக்கம் சார்.
ஓகே குட். ஓகே, thank you.
செக்ரட்டரி மேடம் விட்டா ஏந்து நின்னு படிக்க சொல்லிங்க போல இத உட்கார்ந்து படி கொடுங்க.
திடீர்னு ஸ்ரீபிரியா வரலன்ட்டாங்க, அதுக்குதான். வேற
ஒன்னும் பிரச்சனை இல்ல, ஒன்னும் பிரச்சனை இல்ல. உங்களுக்கு என்ன பிரேயர் ஃபர்ஸ்ட் படிக்கணும்னு சொல்லுங்க, நான் படிக்கிறேன்.
எதுனாலும் ஓகே, பிரேயர் படிச்சா போதும்.
என்ன மதன்? மஞ்சளா மேடம்
அருள்பாணி சார் வச்சிருக்கீங்களா பிரேயர்?
இருக்குமா இருக்குமா, ஐ அம் ஹேவிங் இட். செக்ரட்டரி மேடம் விட்டா ஏந்து படிக்க சொல்லிங்க போல இத உட்கார்ந்து படி கொடுங்க.
திடீர்னு ஸ்ரீபிரியா வரலன்ட்டாங்க, அதுக்குதான். வேற
ஒன்னும் பிரச்சனை இல்ல. மதன் என்ன ரொம்ப லேட்டா கேக்குது பேசுறது எல்லாம்?
அதுதான் ஏன் லேட்டா கேக்குது, லாக் ஆகுது.
இப்ப கேக்குதா?
லைட்டா ஒரு பாட்டு பாடு, கரெக்டா இருக்கா பார்க்கலாம். மைக் டெஸ்டிங். ஹலோ மதன், சாப்பா சாப்பாடு சாப்பா சாப்பாடு சர்ஜமத்த சரியா பாடு.
சாப்பாடு சாப்பிடுறது என்ன சொன்னீங்க?
சும்மா சைக்காட்ரி மீட்டிங் நம்மள முதல் பேஷண்ட் ஆக்கிடுவாங்க. இவங்களை தான் நான் ட்ரீட் பண்ண முதல்ல அப்படின்னு. இதுங்க நான் கொஞ்சம் அடைக்க ரசிக்கிறேன். இந்த மஞ்சளா மேடம் ரெடியா இருக்கிறாங்க என்ன ட்ரீட்மெண்ட் பண்றதுக்கு.
மேடம் உங்களை கோ-ஹோஸ்ட் ஆக்கிட்டேன். நீங்க உங்க ஸ்கிரீன் செக் பண்ணீங்க. பிபிடி அன்மியூட் பண்ணீங்க மேடம்.
செக் பண்ணிடுறேன் சார். ஷேர் ஸ்கிரீன் அசோக்கும் இது பண்ண. ஓகே,
அவர்தான் பண்ணிடுறேன். ஜாயின் பண்ணிட்டாரு அசோக்.
அவர் ஜாயின் பண்ணிட்டாரு.
உங்களுக்கு
என்னோடது வருது இல்ல சார் ஸ்லைட் ஷோ?
வருது வருது.
இப்போ
சொல்லுப்பா. ஹலோ,
இப்போ இது வந்து
சொல்லுப்பா.
ஃபைல்ஸ் இல்லையே, இருங்க.
யூடியூப் வருதா செக் பண்ணிடுங்க ஒரு நிமிஷம்.
Exit full screen. Minimize this. Wait.
Live on YouTube.
Well-being தானே? இருங்கப்பா. எனக்கு எப்படின்னு தெரிஞ்சிச்சு. Exit minimize video. Share screen.
அவங்க ஸ்கிரீன் அசோக் சார் குட் ஈவினிங் பண்ணிட்டாங்க பாரு.
co-host தான்ப்பா. Share screen பண்ணிட்டு
டெக்னிக்கல் சப்போர்ட் பை மிதுல் குமரன். எல்லாம் அவர் பண்றதுதான் கரெக்டா நடக்குது மேடம்.
சார் ஸ்கிரீன் ஷேர் பண்ணது
பாருங்க, கரெக்டா போட்டது பாருங்க, அருமையா போட்டது பாருங்க.
அசோக் சார் கோ-ஹோஸ்ட் ஆக்கிட்டேன். சர்வா நீங்க அன்மியூட் பண்ணுங்க.
மஞ்சுளா மேம் கோ-ஹோஸ்டா இருக்காங்க. அசோக் வந்து ஷேர் பண்ண முடியுமான்னு பார்க்கணும். மஞ்சு மேம் ஷேர் பண்ணுங்க உங்க ஸ்லைட.
வருது பாத்துட்டாங்க.
பாத்துட்டாங்களா? அப்போ ஸ்டாப் ஷேர் கொடுத்துடலாம். சோ அசோக் செக் பண்ணிட்டோம்.
மேடம் நீங்க ஒரு ஸ்டாப் ஷேர் கொடுத்துருங்க, அசோக் சார் செக் பண்ணிட்டோம்.
மஞ்சு மதன் சார் இது பாருங்களேன், உங்களோட ஃபேஸ்புக் கனெக்ட் ஆகல. லைவ் ஆன் யூடியூப் மட்டும், ஃபேஸ்புக் வரல.
அதுதான் ஒண்ணுதான் போதுங்க.
இல்லையே, ரெண்டுமே வரணுமே.
இது கிளிக் பண்ணா அது மட்டும் தான் போதும்.
சரி, அப்போ யூடியூபே இருக்கட்டும்.
ஏன்னா நான் ஃபேஸ்புக் கிளிக் பண்ண யூடியூப் கனெக்ட் பண்ண முடியல.
அருள்பாரி சார் ஏதோ சொல்றாங்க.
நர்மதா உங்க வாய்ஸ் கொஞ்சம் ரொம்ப எக்கோ ஆகுதுமா. உங்க வாய்ஸ் தான் ரொம்ப எக்கோ ஆகுது.
ஓ, அப்ப நான் வாய்ஸ் இது கொடுக்கிறேன்.
உங்க வாய்ஸ் தான் எக்கோ ஆகுது ரொம்ப.
ஒரு நிமிஷம்.
கரெக்ட்டா கேக்குதா சார்?
இப்ப கரெக்ட்டா இருக்கா சார்?
கொஞ்சம் ரொம்ப எக்கோ வர மாதிரி இருக்குது உங்க வாய்ஸ். அது மட்டும் பாத்துக்கோங்க என்னன்னு.
இல்ல, எனக்கு கரெக்ட்டா இருக்கு. மதன் சார் கரெக்ட்டா இருக்கா? இப்ப வாய்ஸ் வால்யூம் குறைச்சிருக்கேன்.
கரெக்ட்டா இருக்கு.
டாக்டர் அசோக், நீங்க ஷேர் பண்ணிக்கிறீங்களா? உங்க ஸ்கிரீன் பார்த்து செக் பண்ணிக்கிறீங்களா?
மதன்
சொல்லுங்க சார்.
chat boxல நிறைய பேர் they are logging in with their email IDs and all. past president யாரெல்லாம் போட்டுருக்காங்க பாருங்க. அது என்ன, நீங்க அவங்கள அக்செப்ட் பண்ணுமா என்னன்றது நீங்க பார்த்து பண்ணுங்க.
chat box சார் एक्चुअली மெடிக்கல் கவுன்சில் வந்து இப்ப டிஎன்எம்சி இப்ப வந்து கிரெடிட் பாயிண்ட்ஸ் தராங்க. நம்மளோடது ஆல்ரெடி அப்ளை பண்ணிட்டோம். பட் நம்மளோடது வந்து இன்னும் அப்ரூவல் ஆயிடுச்சிட்டு 1 வீக் முன்னாடி. இப்ப தமிழ்நாடு மெடிக்கல் கவுன்சில் எல்லாத்துக்குமே நம்ம இந்த ஆன்லைன்க்கெல்லாம் 1 கிரெடிட் பாயிண்ட் they give.
ஓகேமா.
செஷன் அதுக்காக they are all logging in with
அதுக்காக அது
குட்.
So mail ID recorded and keep it so that நம்மளுக்கு வந்து பின்னாடி we will use it. நம்ம அனுப்பி வைக்கலாம் உங்களுக்கு. அனுப்பிட்டேன் ஆல்ரெடி. அசோக்கோட தான் மஞ்சுளாவோட தான் இன்னும் அப்ரூவல் ஆகல அவங்களுக்கு.
ஓகே ஓகே. சாட் பாக்ஸ் செக் பண்ணிக்கோங்க மதன்.
ஆமா ஆமா. அவங்க அந்த அட்டெண்டன்ஸ்க்காக அவங்க பண்றாங்க. அசோக் ஷேர் ஸ்கிரீன் வருதுங்களா உங்களுக்கு? நீங்க பெட்டர் ஷேர் ஸ்கிரீன் பண்ணிடுங்க. உங்களோட ஸ்கிரீன் பிபிடி பிரசன்டேஷன்.
ஷேரிங்ல தான் இருக்கு. இப்ப வருதா?
என்னப்பா?
உங்க டெஸ்க்டாப் வியூ ஆகுது சார், வியூ ஆகுது.
உங்க டெஸ்க்டாப் வியூ
பிபிடி வேணும்னா நீங்க ட்ரை பண்ணுங்க.
ஸ்கிரீன் ஷேர் இது மட்டும்.
ஓகே, நான் அது பிபிடி ஓபன் பண்ணிட்டு பார்க்கிறேன்.
ஓகே, அப்ப ஸ்டாப் ஷேர் கொடுத்துருங்க.
ஓகே.
சார் இன்னும் ஒரு 5 minutes வெயிட் பண்ணலாமா சார்? 6:30 ஆயிடுச்சு, 6:35 ஆயிடுச்சு. 32
ஸ்டார்ட் பண்ணிடலாம் மேடம்.
ஸ்டார்ட் பண்ணிடலாமா? ஓகே.
6:32 6:35 ஸ்டார்ட் பண்ணிடலாம் ஷார்ப்.
6:35 ஸ்டார்ட் பண்ணுங்க.
ஓகே, 5 minutes அவ்வளவுதான். பாரி சார் ஓகே இல்ல?
யா, மத்த டிஸ்ட்ரிக்ட்ல இருந்து வந்திருக்காங்க. we welcome everybody.
குட் ஈவினிங் நர்மதா மேடம். அன்மியூட் பண்ணி பேசுங்க. கேட்கல, உங்கள் வாய்ஸ் கேட்கல. அன்மியூட் பண்ணி பேசுங்க.
தியாகராஜன் நீ வேற சும்மா பாஹிரா ஜலாலு சென்டர் கமிட்டி. எனக்கு இது கம்ஃபர்டபுளா இருக்கு. விடுக்கிறேன். நிரஞ்சன் டாக்டர் என்னப்பா 39 participants இருப்பாங்க.
See waiting.
வெங்கட்ராமன்.
Just okay. They are admitting. Okay.
யூரின் போர்ட்ல வந்து யூரின் முன்னாடி
யூரின் போற இடத்துல
சார் ஸ்டார்ட் பண்ணலாமா?
ஸ்டார்ட் பண்ணிடலாம் மேடம். ரைட் டைம். ஓகே.
எவ்வளோ நாளா இருக்கு?
எல்லாரும் மியூட் பண்ண சொல்லிடுங்களேன்.
Good evening all. We welcome all of you. IMA Vellore takes great pleasure in hosting you. எல்லாரும் ஒரு தடவை வந்து உங்களோட இது மியூட்ல இருக்கான்னு மட்டும் செக் பண்ணிக்கோங்க. Okay. Thank you. Now I request Arul Pari sir to start the meeting with the formal IMA prayer and physicians prayer.
Good evening all. IMA prayer. May everybody be happy. May every one of us see to it that nobody suffers from any pain or sorrow. I do not ask for crown, nor I wish to be in heaven or reborn. I only want to alleviate the suffering of those people who are burning in fire of sorrow. Physician's prayer. Dear Lord, thou great physician, I kneel before thee. Since every good and perfect gift must come from thee, I pray, give skills to my hands, clear vision to my mind, kindness and sympathy to my heart. Give singleness of purpose, strength to life, at least a part of the burden of my suffering fellow men, and a true realization of the privilege that is mine. Take from my heart all guile and worldliness, that with the simple faith of a child, I rely on thee. Thank you.
Thank you, sir. Now we request the speakers, Manjula ma'am and Dr. Ashok sir, to switch on the videos. We thank you for coming. Now I request Dr. Madan sir to welcome all with his welcome address.
Good evening, everyone. Vellore IMA takes immense pleasure in welcoming all the delegates who have joined from all over Tamil Nadu. And I'm very much happy about the topic which we have chosen today, which is right for the scenario, the current scenario. I'm very thankful to Dr. Manjula Devi Madam and Dr. Ashok sir for accepting our invitation and telling about what is the need of the hour. This topic, why we have chosen is for two main reasons. One, this COVID pandemic had created so much of frustration and so much of change in our lifestyle. It has brought into our routine practice has been changed completely. So for that, we have to equip physically and also mentally. So to that, this talk will be an highlight. And another talk is by Dr. Ashok sir, who had struggled his life and come out of COVID-19. So we wish to hear from you, sir, about how you faced and came out of it, which will be helpful for other doctors and other medical community people to come out of what we faced regularly. I welcome one and all. Thank you.
Thank you, Dr. Madan. We have some State President Dr. Krishnan sir and many who are joined from other branches also. We take great pleasure in inviting you. Thank you for coming, sir. So now I would want to present the secretary report for the activities of Vellore IMA during this, since we had our Doctors' Day celebrations. So we had the CME program on finances on August 10th by Dr. Trimlay Kurunda and Dr. Wilson sir. It was well attended we had more than 110 delegates from all over the state attending the program. It was very well appreciated, and I thank our IMA members for giving us full support for the various activities we are doing. And we went and garlanded Dr. P.C. Roy's statue. We had a very grand function last November under the presidentship of Dr. Mageshwaran sir for inaugurating this statue, and this year we could not make it as a grand function because of the COVID scenario, but we could at least go there and garland the statue on that day. And as you all know, the Doctors' Day virtual cultural program was a grand success. We had the singer Hariharan coming, and it was also a well attended program and went on for more than 3.5 hours with the state office bearers attending it. And the national the Nutrition Week celebration was celebrated by our branch in cooperation with FBMT Jain School, where we gave a talk for about 2 hours on nutrition and picky eating in children. And it was a very interactive session with the parents, and it was also live on YouTube with more than 1,100 viewers. And as a part of the COVID activities, firstly donated about 100 groceries to the destitute people near Ariyur village in cooperation with District Social Welfare Board on behalf of IMA Vellore. And we also had an activity along with Auxilium College student. It was an MPH, the Mission Pink Health activity, as well as an awareness for coronavirus. And this was given to first year MBBS students who are doing their hospital administration. It was again a 2-hour session, and it was well attended by more than 110 students and staff members. Independence Day celebration by flag hoisting was done by our president in the front of our executive board members, and hope at least by Republic Day we would have a full session of everybody coming and attending the program, and we would have a direct meeting, not this webinar here. So this was activity we could do in the month of July to September, and we hope we will do many more activities in the coming months. And instead of the virtual activity, we hope to have a direct physical meeting. Thank you. And now I request, as our treasurer is today is not able to join, we will present the treasurer report in the next meeting. In fact, we got our N95 mask and the sanitizers, and that was a only financial transaction that was undertaken during this 2 months period. Okay, so can we, Dr. Madan sir, can we invite the speakers and start the session?
Now we'll have 2 minutes morning session for SPB and.
So we'll have a 2-minute silent prayer for the singer, our very beloved SP Balasubramaniam sir. So I request everybody for a 1 minute standing. Thank you all. It was a very great loss and one of the very sad phase of coronavirus. And I hope this session would be apt to take care of our physical, mental, and spiritual health. So over to Madan sir.
Yeah. And now I request the main speaker of today, Dr. Manjula Devi Madam, who is a well-renowned psychiatrist of Vellore from Raj Nursing Home. Whenever we ask for any help, she is ready to accept for IMA on behalf of IMA. She has done so many activities for IMA, and this is one another activity for her, which we are very thankful. Thank you, ma'am. And I request to go on with your show. Please unmute your mic and talk. Continue your talking, madam.
We will have a half an hour session after the meeting, and then the interaction will be after the speech.
Yeah. You can share your screen, madam.
Yes. Good evening to one and all. At the outset, I would like to thank our IMA office bearers for giving me this wonderful opportunity. A very warm welcome to one and all. Good evening, our senior members, colleagues, and friends. At the outset, I would like to talk a few words on how do we maintain our mental well-being, especially among doctors during COVID-19. Next. The introduction. In Jan 2020, the WHO, the World Health Organization, declared the outbreak of a new coronavirus, COVID-19, to be a public health emergency of international concern. WHO stated that there is a high risk of COVID spreading to other countries around the world. In March 2020, WHO made the assessment that COVID-19 can be characterized as a pandemic. WHO and public health authorities around the world are acting to contain the COVID-19 outbreak. This is one of the statement of a doctor who has been in the emergency department of medical emergency, and the statement goes like this: the business of acute medicine has always intrigued me. I enjoy what I do, but never in my life have I been so anxious getting to work. The worry about the family in case things go wrong accentuates fear. Doffing is not as easy as pictures may demonstrate. We are always concerned that you might have touched something inadvertently. On-calls are not very busy, but every single case is intense. I am tired of reading the guidelines. Work-life balance has hugely shifted. Social media, television, or some other source of entertainment, including chat with the family, will somehow take me to the same environment. Believe it or not, this is the third world war with an invisible enemy. I wish life returns to normal. I felt great when everyone clapped for the key workers. And you know what? We deserve it. Healthcare workers knowingly walk towards a line of danger to save lives. I call that heroism. Whether accepted or not, I'm a hero too. How much does it all affect all of us who are going and entering the same scenario? Most of our colleagues are in the same place, in the same phase of life as this friend of us. So, why are we so much worried about this? Is about the uncertainty of COVID. We all have these set of questions in our mind. When will this end? Will I or my loved one gets infected? If so, what is the next way to come out? Will I keep my job or get a job? Will I ever get back to normal? What about our finances? How do we juggle our kids? How do we stay healthy and productive? These are some of the questions which keep going in our minds. And one thing we have to worry on about all things is that one, we need to have empathy.
From Angela, can you
Yes.
just check on your audio? It is not very clear. Audio.
Audio? Okay.
I think there's some internet connection problem. So
Internet.
you continue, madam. You continue.
continue.
Continue, madam.
1 second.
Yeah.
Yeah. So one thing which we need to have is the empathy. There is a difference between sympathy and empathy. So empathy means that we are actually feeling what the patient or our doctor.
Am I audible now, sir?
Very clear now, ma'am.
So empathy is one thing which which everyone needs to have, and this is not so. Though it is a very common human emotion, it's not universally present. So COVID-19 has and is likely to, when referring to people with COVID-19, do not attach the disease to any particular ethnicity or nationality. Be empathetic to all those who are affected in and from any country. People who are affected by COVID-19 have not done anything wrong, and they deserve our support, compassion, and kindness. Coming to media. See, media has a very important role in each and every day's life. And this is like a double-edged sword. And now that media is in our hands, every minute to minute, we keep updating the messages, and all the messages to our dismay is of a negative one. So what do we need to have a control over this media is minimize watching, reading, or listening to news about COVID-19 that causes you to feel anxious or distressed. Seek information only from trusted sources, and mainly so that you can take practical steps to prepare your plans and protect yourself and loved ones. Seek information updates at specific times during the day, once or twice. If we have an alert for each and every message what we are getting, we seem to become more and more anxious and more of a distress. The sudden and near constant stream of news reports about an outbreak can cause anyone to feel worried. Get the facts, not the rumors and misinformation. Gather information at regular intervals from the WHO website and the local health authority. One more important thing is being positive. Stay positive is one of the important things which we need to carry on during this COVID period. And we have to stay positive. And they have found, researchers have found that the resilience, being positive is one of the important resilient factor to protect us against any type of infections as such. So find opportunities to amplify positive and hopeful stories and positive images of local people who have experienced COVID-19. For example, stories of people who have recovered or who have supported a loved one and are willing to share their experience. And in the following speaker, Dr. Ashok, will be throwing light on this, and we'll know how to overcome certain difficulties and problems in our life as well. So positivity is a main feature. Coming to stress. Feeling under pressure is a likely experience for you and many of your colleagues. So what happens is whenever there is a stress, our body has certain defense mechanisms to cope up with the stress. So this stress, when it is in the minimal side, or when you take the stress associated with the anxiety, it is like an inverted U-shaped curve. So whenever there is mild levels of anxiety or mild levels of stress, maybe we can overcome it by our anticipating defense mechanisms. But when the stress is too much, then our coping skills become maladaptive. So we need to see that the stress is under control, and it is quite normal. And one thing we need to remember during this time of COVID is it is quite normal to be feeling this way in the current situation. Stress and the feelings associated with it are by no means a reflection that you cannot do your job or that you're weak. Many times doctors always want a control of the situation, of the disease or the disorder, but this is one scenario where we do not know where it is going to lead and which are the patients who among us are going to become more affected or who is going to get less affected. This doesn't mean that we are going to be feeling situation because of some wrongdoing personally. And this is a fact that it is like a war going on with so many uncertainties, feeling of shame or guilt which is associated with this. Managing your mental health and psychosocial well-being during this time is as important as managing your physical health. Now, how do you cope up? So coping skills, so what they actually say is stress and the coping skills is very important. So it doesn't depend on how big the stress is. It depends on how well you adapt or how well you cope up with the problems. So there comes the way on how we cope up with this present scenario. The thing is, take care of yourself at this time. No one would have ever experienced this or ever come to know being in this state, because we do not know what our problems are, what the problems are, underlying problems is going to be, and everything is like a question mark at this scenario. So try and use helpful coping strategies such as ensuring sufficient rest and respite during work or between shifts, eat sufficient and healthy food, engage in physical activity, and stay in contact with family and friends. Avoid using unhelpful coping strategies which are maladaptive, such as use of tobacco, alcohol, or other drugs. Though this type of maladaptive behaviors may be okay in the short term, whatever it does is it can worsen your mental and physical well-being as well.
Manjula ma'am, can you speak little louder and keep the mic near your lips? Yeah.
The COVID-19 outbreak is unique and unprecedented scenario for many workers, particularly if they have not been involved in similar responses. Even so, using strategies that have worked for you in the past to manage times of stress can benefit you now. So what happens is, in the past, we would have had some stress, and we would have had a different mechanism to cope up with that. For example, you would have felt better if you would have spoken to a family member, or you have gone into some of your passions like painting, drawing, that would have helped you in the past. So similar responses can benefit you even in the present. So you are the person most likely to know how you can de-stress, and you should not be hesitant in keeping yourself psychologically well, because this is not a sprint, it's a marathon. Coming to stigma, there are so many stigma factors associated with this, even among doctors. Some healthcare workers may stigma or fear. This can make an already challenging situation far more difficult. If possible, stay connected with your loved ones, including through digital means, is one way to maintain contact. Turn to your colleagues, your manager, or other trusted persons for social support. Your colleagues may be having similar experiences to you and they might be of help. For example, if you're not able to know how to manage the financial crisis, we have our expert advisors by Dr. Satish and our previous webinars which showed some light on that. So that could be you can speak to your members or colleagues so that they can help you in these times. Care. Now that you're running the hospital and we have staffs to be taken care of, then how do we take care of them? Ensure that good quality communication and accurate information updates are provided to all staff. Rotate workers from high stress to lower stress functions. For example, you can keep on a rotation basis so that the people who are working under high pressure, like in the emergency, can be shifted on to a lower stress levels at regular intervals so that both feel comfortable with each other. Then partner inexperienced workers with their more experienced colleagues. This is called as a buddy system, and reinforce safety procedures. Ensure that the outreach person enters the community in pairs. Initiate, encourage, and monitor work breaks. Implement flexible schedules for workers who are directly impacted or have a family member affected by a stressful event. Ensure that you build in time for colleagues to provide social support to each other. Coming to the medication, now the scenario has changed, but during the initial phases where the hospitals were closed and the patients as well as the doctors, where we did not have a proper availability of medications, you ensured the availability of essential generic psychotropic medications at all levels of healthcare. People living with long-term mental health conditions or epileptic seizures will need uninterrupted access to their medication, and sudden discontinuation should be avoided. Coming to childcare, now that everyone are in the same home, same house, and it depends on how, and the scenario is such a way, we have never been in this scenario throughout our lifetimes. Maybe if everyone are together, that means that we are going for a picnic or an outing or for a trip. This is what has been, we are having the scenario for so many years. But now everyone are there along with each other for a whole lot of time. And this is being a pressure to both the parents as well as the children and the family members as well. So help children. It is not that because they're a child, they won't have any anxiety symptoms or they do not have any problems. It's not so. So help children find positive ways to express feelings such as fear and sadness. I had a child who was around 10 years old, and she had so much of fear that she might have contracted the illness, or she would be contracting the illness. See, look at the age of 10 years having this fear, kept on asking me, "Enakku onnu aagadilla, enakku onnu aagadilla." This is the only question she was asking from the time she entered my room until she went out of my room. See, this is the type of scenario. It is not that only the adults get affected. Sometimes we fail to notice the smaller things in the child when they're not able to express their own emotions. Sometimes what we can do in that cases is engage them in a creative activity such as playing or drawing, which can facilitate this process. Children feel relieved if they can express and communicate their feelings in a safe and supportive environment. Coming about the family chores, just because we all are at home, we do not know what to do. And if we are feeling that the family, and in the initial stages when there were lack of mates and we had stopped all the mates, managing family chores is a very huge thing. And how do we do this is maintain familiar routines in daily life as much as possible, or create new routines, especially if children must stay at home. Provide engaging, age appropriate activities for children, including activities for their learning. Now, the screen timing for the children has increased. There was a time when we were saying that children should not be exposed to the screen for more than 1 hour. But now the scenario has changed where the children, instead of entering the classrooms, are entering the Zoom meet. And it becomes all the more difficult to manage them all the time and to monitor them as well. So provide engaging, age appropriate activities. So, where possible, encourage children to continue to play and socialize with others, even if only with the family, when advised to restrict social contact. Have like a indoor games where you can, in screen timings, you can interact with your children, have nice games and play music, learn all together in a closed way. Coming to the emotional support to the child. During times of stress and crisis, it's common for children to seek more attachment. They become more demanding. And this becomes very difficult for the parents as well. So you can discuss the COVID-19 about this problem with your children in an honest and an age appropriate way. Do not frighten them too much. Similarly, do not give them, it's okay even if you are do not washing if you are not washing your hands, and giving things in an opposite way. So you can be very honest in discussing with your child. And if your children are having concerns, addressing them together may ease their anxiety. Children will observe adults' behaviors and emotions for cues. It's not that you give just the information and you react in a different way. Children take parents as their role models. And if we are giving them cues that we are more anxious and we are more worried, then that will be taken as a cue on the child, and they will not know how to manage their own anxiety. So it is how well the elders manage or the people at their home manage. Similarly, the children will be able to manage their own anxieties. Coming to elders, so we say that children and elders are the one who are more vulnerable in this period of time. And how do we take care of these elders? So older adults, especially in isolation, and those with cognitive decline or dementia, may become more anxious, angry, stressed, agitated, and withdrawn. They may not show the exact signs of depression during this time, whereas they may become more anxious or stressed or agitated. And provide practical emotional support through informal networks like families and health professionals. Share simple facts about what is going on, and give clear information on about how to reduce the risk of infection in words older people with or without cognitive impairment can understand. So let it make it simple, and repeat the information whenever necessary. What happens is they seek for repeated reassurance, whether this is coming down, whether the cases have increased. It's a constant matter which is going in their minds repeatedly. So instructions need to be communicated in a clear, concise, respectful, and patient way. It may also be helpful for information to be displayed in writing or pictures. Then engage family members and other support networks to discuss practical steps like hand washing, wearing a mask, social distancing. All this can be engaged. Coming to having a exercise and routine. So most of the times, if we are being used to go only for gym for workouts, and which is not possible during this COVID, and we are afraid of social contacts and things like that. Learn simple daily physical exercises to perform at home, in quarantine or isolation, so you can maintain mobility and reduce boredom. Keep regular routines and schedules as much as possible, or help create new ones in a new environment, including regular exercising, cleaning, daily chores, singing, painting, or other activities. Keep in regular contact with the loved ones, example via telephone, email, social media, or video conferences. Stay connected and maintain your social networks. See, social network is one thing which is very handy in this crisis time. Try as much as possible to keep your personal daily routines or create new routines. If health authorities have recommended limiting your physical social contact to contain the outbreak, you can stay connected via telephone, email, social media, or video conference, like the initiative taken up by our Velima in conducting webinars and helping us updated through our WhatsApp group. During times of stress, do not ignore yourself. Pay attention to your own needs and feelings, very important. Engage in healthy activities that you enjoy and find relaxing. Exercise regularly. Keep regular sleep routines. Just because we do not have anything to get up and do in the morning, doing all the other works late in the night and getting up very late in the morning, this should not happen. And you should have a regular sleep routine and eat healthy food. Keep things in perspective. Public health agencies and experts in all countries are working on the outbreak to ensure the availability of the best care to those affected. So, information, what we have calling is this COVID pandemic is a region of too many information, that is called as too many information from morning till night, and a near constant stream of news reports about an outbreak can cause anyone to feel anxious or distressed. And as I said previously, seek information updates from WHO or from a local health authorities. Do not follow the rumors that make you feel uncomfortable. So in spite of all this mental care and the psychological well-being which we have taken place, there are certain illnesses which occurs during COVID. Especially this can happen to us or one of our family members, a colleague, or the neighbors or anyone. So to a period of 1 month, then we call it as an acute stress disorder. When it crosses months, then we call it as a post-traumatic stress disorder. Since we are in this phase of the trauma, still we are undergoing, we cannot actually say it's a post-traumatic stress disorder because the trauma has not yet ended and we do not know when this is going to end. And it's an important mental health concern for all the psychiatrists all over the world. Like, how are we going to deal with the post-traumatic stress disorder, which we had seen in the case of tsunami in the previous years. And this is an ongoing study that the amount of the number of post once this COVID pandemic has lasted. And the other symptoms are anxiety, depression, and substance use disorders. So acute stress disorder, there is a sense of numbing or detachment, reduced awareness of the surroundings, derealization, where you feel that the surrounding has changed, which can occur in acute stress and in a shock-like state. Depersonalization, where you feel that you have changed, or the in relative to the despair and hopelessness. Coming to the post-traumatic stress disorder, a person who has come from a near-death experience. There are so many things happening in his mind. So these things could be it could be an indicator of a post-traumatic stress disorder. What happens is, especially when patient or doctors, there is a lot of things going on in their mind when they feel that they do not have a control over the illness or over the disease or over the treatment. They feel totally lost. A sense of shame or guilt arises, and this leads to be when they keep remembering this event again and again, which leads to this hyperarousal. Hyperarousal is a state of persistent anxiety even after the traumatic situation has ended. They may have features showing irritability, insomnia, and poor concentration. Then intrusions are they have difficulty in recalling the stressful events at will, and but there what is it called as a flashbacks or reliving of the same trauma which they had undergone. This is called as intense intrusive imagery, which keeps disturbing them of time and again, and there is a recurrent distressing dreams. And what do they do is avoidance of reminders of the events. For example, if an other family member of the same family is also involved in this COVID, or is also suffering, they may try to avoid giving to them or giving support to them, because avoid the reminders of these events, which would again remind them of the past trauma which they have undergone. So this could be an important point here, where a sense of detachment occurs, and the person who is suffering or going through COVID, they feel that the person is not caring for them, though he has undergone the same problem. Maybe he is not able to support me. These are the questions which arise in the persons who are a close relative of the family. They have a sense of detachment from everything, numbness, and diminished interest in activities which they were actually previously doing with interest. So coming to the anxiety. So as I told you, anxiety is a threat to life. And what they say is minimal amount of anxiety is a must to carry on with your day-to-day activities. And if this anxiety is mild, you have this inverted U-shaped curve, which I told you. If it is at a optimal level, it brings about an optimal performance. But during this COVID times, with the too much of infodemics, that is too much of information, too much of people suffering, and we are seeing them who are our close associates, this brings about a lot of anxiety features, which is which goes beyond our coping skills, and it becomes maladaptive and amounts to a kind of disorder. So the psychological arousal, which results in fearful anticipation, irritability, sensitivity to noise, restlessness, poor concentration, worrying thoughts. And the autonomic arousal, like which if it affects the GI tract, they can have dry mouth, difficulty in swallowing, epigastric discomfort, excessive wind, frequent motions. And if it is affecting the respiratory tract, they can have a constriction in the chest, difficulty in breathing, discomfort in chest, genitourinary manifestations like frequent or urgent micturition, failure of erection, menstrual discomfort, muscle tensions like tremor, headache, aching muscles, hyperventilation like dizziness, tingling the extremities, breathlessness, sleep disturbances like insomnia. What you will believe it or not, people having all these would have gone to almost all the doctors, repeated GI symptoms. They feel that it could be a sign or a symptom of COVID, and they go to a gastroenterologist. Once they have this palpitations or discomfort, and most of the patients who come to me with this anxiety symptoms, now it is termed as the corona anxiety, they have all the investigations in hands, a bunch of investigations which they have in hand for going from having a regular doctor shopping on a daily basis. And in emergency departments, we have to differentiate what are the actual reasons, or is it more of a psychological one. And this differentiation is very important in the treatment aspect as well. So one more important, anxiety and depression goes hand in hand. Most of the time we come to a diagnosis of mixed anxiety and depression because these two are very comorbid. And in depression, we should have the symptoms like depressed mood is one of the important feature, loss of interest and enjoyment in previously pleasurable activities, reduced energy and decreased activity, reduced concentration, reduced self-esteem and confidence, ideas of guilt and unworthiness, pessimistic thoughts, ideas of self-harm, disturbed sleep, and disturbed appetite. Depending on the number of symptoms, and these symptoms should be present at least for a period of 2 weeks, and this should make them, this should involve in their daily activities, impairment in the daily or social functioning, daily impairment or social impairment, then we classify it as depression. Coming to the conclusion, let us all take the positive outcomes, like how the Annaparavai, which has been described in our mythological studies, mythological books. It is actually the exact meaning, like it has the ability to separate milk and water. The actual meaning is not so. Actually, in this life is filled with duality in lives. One is the day and night, joy and happiness, joy and sorrow, restlessness and calmness, white and black. All these are duals. Similarly, positives and negatives. Negativity in life is a very, very normal phenomenon. This is what we need to take. And we have to think only about the positive outcomes. If we think only about the positive outcomes, then life will be easy and we can stay positive as well. So let us use this time judiciously to look back at our passions, which lay unfulfilled, like painting, art, music, dance, reading, time to spend for our relatives through phone calls. Let us inculcate the art of mindfulness in whatever we are doing. So mindfulness is concentrating on enjoying what we are doing in the present. A very simple one. When I attended a workshop on mindfulness at IMH once, they had this simple experiment. The person gave us a raise or have it. What we did is, as our normal thing, whenever we give something to eat, we just put it in our mouth and just taste it and finish it. But they said you have to speak on this for 10 minutes. And they gave one more reason as well. That was the time when we started admiring the shape, its feel, the edges, how it feels, the color of it, the way it's so clear through as translucent, its translucent capabilities. Then once we put it in the mouth, we could, when we close our eyes and started tasting the resin, it was such wonderful experience. Many muscles of our tongue, our mouth, the teeth, the coordination between each and every muscle part, the whole of this is such a wonderful act, and we have been ignoring this all through our years. And this was a thing of concern for all of us. Then we know that how much God has been. He has been so very kind enough to give so much of activities we have been doing day and night without going into this art of mindfulness. Once we start recognizing and appreciating the things what we have got in life, I think we won't have anything to repent on in this life. That is what I found out after attending the mindfulness workshop. So it's a wonderful thing. Whatever you do, whatever work you do, for example, you go for a walk, coordination when the left hand moves, the right hand moves. See, these are all coordination, which these are all these are all unimaginable things happening even without our notice. Have you ever imagined that the art of brushing itself takes 72 steps? We have been doing daily from the day we know that we knew how to brush until today, and we have never had a time to just enjoy that, to feel thankful for what you have been doing all these years. And that's one such wonderful thing. If we inculcate the habit of mindfulness in our day-to-day practice for each and everything we do, I think we will feel that we are the most blessed ones on earth. Go for regular walks on your terrace. Now that going outside will be a problem because of the social distancing issues, go for regular walks on your terrace, do mild exercises, eat properly, healthy diet consisting of fruits and vegetables, drink plenty of water, spend time reading books, especially our religious book. Why this religious books is the sense? See, this has in store whatever we need for our daily lives, and we have been ignoring this because this was not a part of our curriculum. And in the age old, in the gurukulas, they were taught how to lead a life. Now we are taught how to write an exam and how to score in the exams. This is not so actually. When this many people ask, many in schools also they ask, there are so many issues going on in the schools with child exposed to pawns, or is sex education a necessary one? These are the questions on debate going on. Then I say, if only we could inculcate this spiritual practice from a very I mean, tend to bring the spirituality in life or in schools, then there would be no necessity for sex education as such. See, this is an important point, and I'm telling this because this COVID, I had, I was blessed to read all these books, and most of the books I completed, and I really thank, and that was really an eye opener for me, that all these days I have been wasting time not looking into it. So this is one important thing. Cherish your time with kids. Very, very important. Then coming to yoga. Yeah. So the role of yoga in health aspects of an individual, especially the mental health and the society, is multidimensional. Now, many research have been taking place, and there are a lot of publications both in the Indian Journal of Psychiatry and the American Journal of Psychiatry, that yoga is a practice that is spread across the world. And one of the pioneers in India is a person from Gangadhar, named Gangadhar, Dr. Gangadharan, psychiatrist, who is the HOD in Nimhans department, in Nimhans Hospital. And he has put a lot of papers on this. And he says that yoga and mental health is very close association. And this yoga involves three components. So it involves gentle stretching exercises, breath control exercises, and meditation. See, what we say is to nurture our physical activities, or to maintain our physical health, we take so much of pains like walking, eating regularly, and having regular interval food, sleep. All these are our physical things. But for mental, what we do, we stressed on the event of staying positive, being connected with the people, being connected with the people through social media. Then we have this mental activities like like painting or pursuing your career, being happy and things like that. But what do we do to do the to the soul? That is where so many of us a lot of problems, especially when we do not have a control actually know what soul meditation. So meditation should be inculcated as a part in our started initiating where it will do things. That is what the media has been telling, like go inside, go inside. This is what it actually means. We have to go to the level of the soul by crossing physical and mental. Now our focus is on that, and if that we are able to nurture with meditation, then I think all these worries and anxieties will not be there. Yoga is considered as one of the earliest and most effective methods of providing peace and tranquility, and we should be proud enough that we have come from this land where there is where it roots. And now the Westerners are following a lot of yoga practices for to overcome these mental health problems. And we still are in a phase whether we have to accept it or not. There are so many questions going on in our minds, but definitely it has beneficial changes in the neurotransmitter systems. See, all of the neurotransmitters, which like serotonin, dopamine, the norepinephrine, the hypothalamo-pituitary adrenal axis, changes in the neuroplasticity and immune system, it has an effect on almost all. Yoga has a almost all effectivity on all these, and these systems are implicated in the pathophysiology of anxiety, insomnia, depression, all of which are the commonest psychiatric conditions during this COVID-19 outbreak. It also correlates and regulates the imbalances of the autonomic nervous system, like the sympathetic overactivity. This explains why yoga practices, even for shorter duration, might help in the reduction of anxiety. So, what I have done is, I have been uh, telling my patients who are, especially these anxiety patients and depression patients, when you give them a short course of, or when you teach them a simple breathing exercises of pranayama, they are able to overcome this anxiety symptoms at the earliest with the daily practice of at least 5 minutes in the morning, afternoon, and night. Breathing exercises actually is for a short period of 5 minutes, so that you all also can go through this. And it I promise you, it gives promising results for each and everyone. That is the one thing which has taken me all this while, and all this through this period of COVID, where it's not that psychiatrists should not have anxiety symptoms, but how do we overcome? And this coping skill, this yoga, was one thing which I had practiced in my daily life. And this 6 months, I think I'm doing good only because of that. So I would like to end from the quote from the Bhagavad Gita, which says, whatever happened was good. Whatever is happening is also good. Whatever will happen, that also will be good. What did you lose that you are crying for? What did you bring which you have lost? What have you created that is destroyed? Whatever you have taken is taken only from here. Whatever you have given is given only from here. Whatever is yours today will belong to someone else tomorrow, and belong to some inevitable change is the law of universe and the objective of my creation. So with this, I end. And now can we have a short meditation for about 5 minutes? Because I have told this to many of my patients, and the results are really, really good. And I promise you that this anxiety patients will not be able to go through this simple exercises, which is called as 555 breathing exercise. Okay, can we all go for a short uh, session of meditation? All of you? Yeah. Now, for this to happen, in whichever place you are sitting, with the legs down, what we can do is,
Manjula ma'am, you have the speaker with near your voice. We are not able to hear you. Yeah.
okay. So, we have seen Shiva having the spiritual eye here, right? So what we can do is, we can put our gaze to this center. For example, whenever you want to, or when you're concentrating too much, you just wrinkle your eyebrows, right? So that is the seat of consciousness, or a seat of attention and focus and concentration. So this seat is called as the spiritual eye. We sit in a comfortable position with our spine straight. Can you all sit with spine straight, parallel to the ground, with the gaze at the Kutastha? This is called as the Kutastha center, or the spiritual eye center, with the hands upturned, with the palms facing upwards, which is at the junction between the upper part and the lower part of the body. What we do is, before going into this, before going into the exercise proper, or the pranayama proper, we just have to contract and relax all the muscle with a double inhalation and a double exhalation. So double inhalation means a short exhalation followed by a long exhalation. This we do while sitting in this posture. Okay. Inhale and tense. While inhaling, you are tensing the whole body from the foot to the head. Exhale and relax with a double exhalation. We'll inhale and tense. Exhale and relax. Inhale and tense. Exhale and relax. Now, with the gaze at the spiritual eye, with the spine straight, just inhale through your nose to a count of 5. Count of 5, and exhale through your mouth to a count of 5. Okay, I'll do the counting for you. Inhale, 1, 2, 3, 4, 5. Hold, 1, 2, 3, 4, 5. Exhale through your mouth, 1, 2, 3, 4, 5. With the gaze at the spiritual eye. Inhale, 1, 2, 3, 4, 5. Hold, 1, 2, 3, 4, 5. Exhale through your mouth, 1, 2, 3, 4, 5. Inhale, 1, 2, 3, 4, 5. Hold, 1, 2, 3, 4, 5. Exhale through your mouth, 1, 2, 3, 4, 5. Now, just with the eyes at the spiritual center, just observe your breathing. Observe the breathing as you inhale and exhale calmly and composedly. Just watch your breathing as though you are in a breeze standing in front of the sea. Just inhaling, exhaling, just enjoying the scenic beauty. Feel the calmness in you. You're feeling more calm and calm. Thank you. If this is one short pranayama thing, our patients, when they are very anxious, they're very restless, not able to sit in one place. And this 5 counting is too much for them. And we feel that we can do until 20 counts, but the patients will not be able to do. And this holding part, they cannot do. So as the breathing goes deeper and deeper, then our mind becomes more calmer and calmer. So this is the way we connect. When your mind is having too much of restless thoughts running here and there, then we can focus on our breathing. This can be used for inducing sleep, for having your mind calm and composed. So I would like to end. If people are interested in you having a meditation class as well, we have learned scholars along with help of our IMA, with the help of IMA member, can have a session along with them. If you tell in advance whether we are willing to have this, then we can organize one as such program also. Then I would like to, this is one of my guru, and he says, by the practice of meditation, you will find that you are carrying within your heart a portable paradise. This is by Sri Sri Paramahansa Yogananda, the wisest guru. And I thank all my colleagues for listening so patiently. And if you have any doubts, this session will be followed by Dr. Ashok's narration of his journey through COVID. And we'll continue with our question and answer sessions after that. I would like you to just raise your hands in the chat box so that we can understand how many of you are interested in this meditation session, so that we can plan in the next coming IMA meetings. Thank you so much.
I think they can put it in the chat box, madam. Thank you so much for the very interesting session. You have taken us from CME to a very spiritual. Thank you so much. Now we'll have Dr. Ashok for a very interesting topic on his rendezvous with COVID-19. Rather, I would say my rendezvous with COVID-19. So it is he's going to talk. So I request Dr. Ashok to kindly share the screen and start the topic. And if anybody has questions, please put it in the chat box, as well as you will be here to ask the speakers directly so that we can get a direct interaction. Madan sir, actually, நம்ம ரெண்டு பேரோட ரெண்டுன்னு சொல்லணும்ல. We were following his results so close.
Welcome to the new world, Ashok sir.
Ashok, please unmute yourself.
ஓ இது வரைக்கும் நான் பேசினது கேட்கவே இல்லையா? அநியாயம். It was an awesome talk, Dr. Manjula. நிறைய மெமரிஸையும் it kindled actually. I went through a lot of what to spoke about when I was in the hospital. It was really a great talk. So, just a minute. Is the share okay? Seen there? Yeah. So I was the only unfortunate member of Vellore IMA who got into the COVID disease per se as such so far. But that has made me fortunate enough in many ways, including this slot for a talk in our prestigious association. Thanks to Vellore IMA for the opportunity. Fortunate enough, I say, because more than anything else, it showed me what enormous love means. Really, what it can do, what miracles it can create was definitely 100%. I could feel that when I was in the hospital, which definitely I'll be going through when I deliver this talk. So shall we go ahead? So this is going to be the outline of my talk. Will it be fine? நிறைய பேர் Zoom விட்டு வெளியே போயிடுவாங்கன்னு நினைக்கிறேன். This is going to be an absolutely informal talk actually. The fight I had with the corona. So nothing to do with the etiology, pathogenesis or anything of that sort. This is totally what I went through in a very colloquial way. So English, Tamil எல்லாம் கலந்து தான் இருக்க போகுது. Hope people are okay with that. This is not a talk, rather. This is going to be an informal chat. That's what I would like to put it across in that way. So actually, I could punch the coronavirus on the face, as you could see in this picture, with the help of the hand that you're seeing there, which is a collective hand of many people, my close relatives, friends, and patients, many whom I don't even know that they are so close to me. All of them gave power to me, which could enable me to do this. The number one skill in life, I always feel, not just in the situation where you have corona, is always not giving up. Fight it out, whatever the thing is. That is what I have learned through life, and that is what actually could make me fight this infection too when it got better of me. I had to come better of it, and I didn't want to give up at any single moment. So this was me, fully enjoying life with my profession, music, photography, poetry, whatever I liked, each one infusing its own energy into me. And then
mic konjam kitta vechinga sir.
Yeah, sorry. Is it okay now? So I'll better take it around my ears so that it doesn't finding it difficult to hold it for long. So each infusing its energy into me in its own way. And then came that day where I ended up here. I have been in and out of hospitals many times as a patient. Though as a doctor, I walk in every day. As a patient, I have moved in and out quite a few times, even for a few surgeries. But this disease had a real shock, and it shook me in a very bad way. Actually, day one, when I was having this fever, we took a CT. CT was looking bad, and everybody advised it's better I get admitted. Initially, we thought home quarantine கேட்டு பார்ப்போம் அப்படின்னு சொல்லி. Anyhow, the district authorities did not accept that. So admission சரி பரவாயில்ல பண்ணிப்போம், CMC வேணா போயிடலாம் அப்படின்னு சொல்லிட்டு then we went to CMC. I actually walked from the parking lot. எந்த ஒரு ப்ராப்ளமுமே இருக்கல. போனோம், அட்மிட் ஆனோம். பட் நர்மதா வந்து ரைட் ஃப்ரம் தென் ஷி வாஸ் வெரி அப்செட் அண்ட் ஷி வாஸ் கிரையிங் லைக் மேட். ஒரு எல்கேஜி குழந்தைய வந்து கொண்டு போய் ஸ்கூல்ல விட்டுட்டு அவங்க அம்மா கேட்லயே நிற்பாங்க. ஆனால் அந்த குழந்தை ஒரு சில டைம், எல்லா குழந்தைங்களும் அப்படி போறது இல்லை, ஒரு சில குழந்தைங்க ஜாலியா ஹாப்பியா ஏதோ ஒரு புது அட்மாஸ்பியர், புது கேம் ஏதோ விளையாட போறோம் அப்படின்ட்டு ஜாலியா ஓடிடும். அந்த மாதிரி நான் பாட்டுக்கு உள்ள போயிட்டேன். ஷி வாஸ் தேர் கிரையிங் அண்ட் மை ஜூனியர்ஸ் அண்ட் அசிஸ்டன்ட்ஸ் எல்லாரும் வந்திருந்தாங்க. எவ்ரி ஒன் ஹேட் டியர்ஸ் இன் தேர் ஐஸ். ஐ டோன்ட் நோ ஃபார் வாட். Actually, like our legendary SPB, I also made a statement standing in the partition. Actually, அதுதான் அந்த கேட். அந்த கேட்டுக்கு அந்த பக்கம் கோவிட் வார்ட், இந்த பக்கம் இவங்க கொண்டு வந்து விட்டுட்டு திரும்ப போயிடணும். அதுக்கு மேல அவங்கள அலோவ் பண்றது இல்லை. ஸோ அந்த இடத்துல நின்றுட்டு ஐ வாஸ் டெல்லிங் தம் இட்ஸ் ஹார்ட்லி 2 நாள் 3 நாள் ஃபீவர் செட்டில் ஆனோடனே திரும்ப அனுப்பிட போறாங்க, எதுக்கெல்லாம் இப்படி அழுதுட்டு இருக்கீங்க, ஒன்றும் பயந்துக்க இல்லை, ஐல் பி பேக், டோன்ட் வரி, கோன்னு சொல்லிட்டு ஐ ஜஸ்ட் வாக்ட் இன். ஸோ டே ஒன் ஆக்சுவலாக பார்த்தீங்கன்னா இந்த வீடியோலாம் போட்டு பண்ணிட்டு இருந்தாங்கல்ல அந்த காலேஜில் அட்மிட் ஆகிறவங்கலாம், அந்த மாதிரி தான் எனக்குமே ஃபீல் ஆச்சு. தே ஜஸ்ட் பேம்பர்ட் மீ லைக் எனிதிங் இன் சிஎம்சி ஃபார் எவ்ரி அதர் பேஷண்ட் ரதர். ஸோ டைமுக்கு எல்லாமே அந்த நான் பார்த்த வாட்ஸ்அப்பில் ஒருத்தர் சொல்லிட்டு இருப்பாரு, வீட்டில் வேவிச்சு தரனா கல்லையே வேவிச்சு தர மாட்டேங்கிறாங்க, இங்கே 11 மணிக்கு நல்லா கடலை சுண்டல் தராங்க, டீ தராங்க, பிஸ்கட்டு, சாப்பாடு எல்லாம் டைமுக்கு வந்துடும். ஸோ டே ஒன் பயங்கர ஜாலியாக போச்சு. ஏன்னா ரொம்ப நாளாக வி ஹவ் பீன் ஒர்க்கிங் லைக் மேட் அண்ட் ஒரு பிரேக் எடுத்தே ரொம்ப நாள் ஆச்சு. இது வந்து ஏதோ ஒரு ரிசார்ட்ல போய் உட்காந்துட்டு அது ஏவாட்டி உங்களுக்கு தெரியும், இட் வாஸ் as if like I was taking a break. And then 2 நாள் எதுவும் பெருசா தெரியல. I was thinking probably another day once my fever settles down I'm going to walk back home or to the hospital again to carry on with my routine work. But day 3 மார்னிங்ல இருந்தே ஃபீவர் கொஞ்சம் ஜாஸ்தியாக ஆரம்பிச்சது. டெம்பரேச்சர் வாஸ் கோயிங் அப். இட் வாஸ் அரௌண்ட் 103, 104, அதை விட்டு குறையவே இல்லை. ஸோ தே ஆக்சுவலி பேரஸ்டமால் மட்டும்தான் அங்கே கொடுத்துட்டு இருந்தாங்க ஈவன் பிஃபோர் தட். அப்போ வந்து SOSல வச்சுருந்தாங்க. அப்புறம் ஃபீவர் ஜாஸ்தி ஆகும். தே செட் 650 எவ்ரி 6 hours. ஸோ சாயங்காலம் வரைக்கும் ஃபீவர் குறையவே இல்லை. ஐ வாஸ் adamant that the consultant has to come and see me so that I can talk to him on whether to start with any other drugsங்கிறது பேசணும்னு சொல்லிட்டு. they said the consultant can't come today, நாளைக்கு வருவார், ஜூனியர் வர சொல்கிறோன்னு சொல்லிட்டு வந்தார். அவர் வந்து பார்த்துட்டு ப்ராப்ளி உங்களுக்கு 650 மில்லிகிராம் பத்தல, கொஞ்சம் பெருசாக இருக்கீங்க, 1000 மில்லிகிராம் மாற்றிக்கலாம் சொல்லிட்டு போயிட்டாரு. அவ்வளோதான். அதை தவிர வேறு எந்த ட்ரக்கும் அன்றைக்கி கொடுக்கல. அடுத்த நாளும் இட் கண்டினியூட். Then the consultant came. I discussed with him regarding starting other drugs, which he said it's not in our protocol unless you get into some issues. எதுவும் தேவை இருக்காது, தேவையில்லாமல் பயந்துக்காதீங்க அப்படின்னு சொல்லிட்டாரு. ஸோ இட் வெண்ட் ஆன். அன்னைக்கும் 103, 104 அந்த 1000 மில்லிகிராம் பேரஸ்டமாலுக்கும் அது பெருசாக ஒன்றும் இட் டென்ட் பாதர் அட் ஆல். அரவுண்ட் ஈவினிங்க்கு மேலே லைக் ஐ வாஸ் ஃபீலிங் லிட்டில் நாட் ஓகே வித் த ப்ரீத்திங். ஐ டென்ட் ஹாவ் டிஃபிகல்ட்டி ஆஸ் சச், பட் சம்திங் வாஸ் நாட் ஓகேங்கிற மாதிரி ஒரு ஃபீல் இருந்துகிட்டே இருந்தது. அண்ட் அரவுண்ட் ஒரு 8:30 த சேச்சுரேஷன் ஸ்டார்டட் டாப்பிங். 95க்கு கீழே போக ஆரம்பிக்கும். ஏவார்டில் தே கிளியர்லி செட் இட்ஸ் நாட் கோயிங் டு பி ஓகே ஃபர்தர், ஸோ வி ஆர் ஷிஃப்டிங் யூ டு level 2 கேர். ஸோ நான் level 2 கேர்னா அவங்க என்ன சொல்கிறாங்கன்னு ஃபஸ்ட்டு புரியல. தென் தே செட் O2 ரெக்யர்மெண்ட் அப்படிங்கிறனால வி கான்ட் கீப் யூ இன் ஏ வார்ட். ஏ வார்டில் only asymptomatic மட்டும்தான் வச்சுப்போம்னு சொல்லிட்டு they shifted. And the one you see on the left is the level 2 care actually. In the center corridor, இதுல கிட்டத்தட்ட ஒரு 20 பெட் இருக்கும்னு நினைக்கிறேன். அந்த பக்கம் ஒரு லைக் வெராண்டா மாதிரி, இந்த சைடில் ஒரு வெராண்டா, ஈச் 10 பெட்ஸ், கிட்டத்தட்ட ஒரு 40 பேஷண்ட்டு. அங்கே ஷிஃப்ட் பண்ணி போனதுக்கு அப்புறம் ஒவ்வொரு பேஷண்ட்டையும் பார்த்ததுக்கு அப்புறம் தான் ஐ வாஸ் லிட்டில் டெரிஃபைட் ஆக்சுவலி. மோஸ்ட் ஆஃப் தெம் வேர் காஃபிங் தேர் லங்ஸ் அவுட். அந்த அளவுக்கு சிக்கா பேஷண்ட்ஸை வந்து பார்த்தே ரொம்ப நாள் ஆச்சுங்கிற மாதிரி இருந்தது. த ஹோல் அட்மாஸ்பியர் வாஸ் லிட்டில் லைக் ஐ குடன்ட் டேக் இட். பட் தே செட், நான் போனோடனே முதல்ல இதான் கேட்டேன், எனக்கு ஏதாவது ப்ரைவேட் ரூம் மாதிரி இருக்குமா லெவல் 2ல. ஐ வாஸ் நாட் பாதர்ட் அபவுட் த ஜென்ரல் பெட் ஆர் எனி திங், பட் ஐ வாஸ் லிட்டில் வரிட் சீயிங் திஸ் பேஷண்ட்ஸ். இந்த மாதிரி நம்மளுக்கும் ஏதாவது ஆயிடுமோ, நமக்கு லெவல் 2 அப்படின்னா இப்படிதான் இருக்கும்னே தெரியலையே. ஐ வாஸ் வெரி மச் வரிட். அண்ட் அதுக்கப்புறம் லைக் தே செட் அதெல்லாம் பாசிபிலிட்டியே இல்லை இங்கேனா, எவ்ரி 5 பெட்ஸ்க்கு ஒரு டாக்டர் இருப்பாங்க, ஏதாவது ப்ராப்ளம்னா பார்த்துப்பாங்க. எனக்கு ப்ராப்ளம்லாம் இல்லை, நல்லா தான் இருக்கேன்னு சொல்லி பார்த்தேன். they didn't believe. And அங்கே ஆக்சுவலாக அந்த காமன் டாய்லெட்ஸும் அவ்வளோ நல்லா இருக்குல்ல. ஸோ ஐ வாஸ் ஆஸ்கிங் தெம் ரைட் ஃப்ரம் த டே 1, எப்போ இங்கேருந்து மாற்றுவீங்க திரும்ப ஏ வார்டுக்குன்னு. they said your O2 requirement has to come down, it has to come to 0, only then we'll be shifting you out. ஸோ எவ்வளோ நாள்னு தெரியலையே சொல்லிட்டு ஒரு டென்ஷன்லேயே தான் உட்காந்துட்டு இருந்தேன். அதை விட டென்ஷன் என்னன்னா, அங்கே நிறைய பேர் என் பேஷண்ட்ஸ் வேற இருந்தாங்க. ஸோ தே குட் ஐடென்டிஃபை மீ. அண்ட் அவங்க அங்கேருந்து சைகை காமிச்சு பேசுறது அதுன்னு. பக்கத்து பெட்ல ஒரு there was another lady, I don't remember who it was, but அவங்க வந்து ரொம்ப சந்தோஷமா உடனே ஒரு வீடியோலாம் ஆன் பண்ணி அவங்க வீட்டுக்கு சாரு இங்கே தான் இருக்கிறாரு அப்படின்னு சொல்லிட்டு பேச ஆரம்பிச்சிட்டாங்க. ஸ்க்ரீன்லாம் அந்த ஸ்க்ரீன் எதுவுமே ஒர்க் ஆகல, அதுக்கு தான் இந்த ஃபோட்டோ போட்டேன். ஆக்சுவலா நானும் என்னென்னவோ ட்ரை பண்றேன் ஸ்க்ரீனை போடணும்னு, ஒன்றும் வேலைக்கே ஆகல. ஸோ there were few people who wanted to take selfies. இதெல்லாம் செல்ஃபி எடுக்கிற இடமாப்பா, ஏன்பா சும்மா இருங்க அப்படின்னு சொல்லிட்டு ஃபர்ஸ்ட் டே ஆக்சுவலா ஜாலியா போயிடுச்சு. though there were so many sick people around, I wasn't so sick, so I was just seeing around and அப்படி பார்த்துட்டு பாட்டு கேட்டுட்டு, லைக் I had my cell phone and earphones along. So only thing was I was on O2 4 liters continuous வச்சிருந்தாங்க. And saturation actually with O2 it was good. Whenever they tried taking me out of O2 support, I started desaturating. So they said it has to be continued in this ward only. And day 2 in the E ward, actually idan level 2 la E ward, anga vandu evening ku mela, despite the O2 and all that, I was feeling little suffocated. appo oru mild cough onu vara aarambichது. It wasn't very severe, but I was little worried again. இது என்ன பிரச்சனை தெரியலையே, இதுக்கு மேல இன்னொரு கேர்னு இன்னும் வேற எங்க கொண்டு போவாங்கன்னு வேற புரியல. So I was perturbed with that. And further I was desaturating pretty rapidly. They kept on increasing the O2 support gradually. It went up to almost 15 liters. Early evening la ஆரம்பிச்சது, கொஞ்சம் கொஞ்சமா as the darkness was settling down in my life too அப்படிங்கிற மாதிரி ஒரு ஃபீல் வந்துருச்சு. Pulse rate was somewhere around 120 and BP started falling down, and they were contemplating on shifting me to ICU because they weren't very sure whether to take up the O2 beyond this. ஏன்னா நார்மல்ல இருந்து வெஞ்சுரி மாஸ்க்கு மாத்தினாங்க, அப்புறம் வெஞ்சுரி மாஸ்க்லயே சப்போர்ட் இன்க்ரீஸ் பண்ணாங்க with the percentage of O2. Despite it wasn't settling down, somewhere around midnight I felt I was pretty giddy, and I just called them, and beyond that I couldn't speak anything. Like ரொம்ப ஒரு மாதிரி இருக்குன்னு கூப்பிட்டேன் சிஸ்டர். She came and they immediately wanted to shift to ICU. ஃபோன் பண்ணாங்க. லக்கிலி அப்பதான் ஒரு பேஷண்ட் ஷிஃப்ட் ஆயிருக்கு வெளியே, ஒரே ஒரு பெட் இருக்கு அப்படின்னு சொல்லிட்டு they started shifting me. Hardly ஒரு 3 minutes of wheeling in from this ward into the ICU. But that 3 minutes, what all was going through my mind அப்படிங்கிறது வந்து I myself can't imagine now. சம்பந்தமே இல்லாம லைக் இன்னும் என்னென்ன லோன் பாக்கி இருக்கு, அதுக்கு என்னென்ன ஏற்பாடு பண்ணி வச்சிருக்கோங்கிறதுல இருந்து 2 பேஷண்ட் அட்மிட் பண்ணிட்டோமே, அவங்களுக்கு வேற என்ன பதில் சொல்ல போறோம், என்னென்னவோ it was running inside my mind. And 3 minutes, yes, I was into the ICU. It was thick of the night. It was somewhere around 12:30 midnight. And ulla pona a group of lady regimen actually full and full அவங்க மட்டும் தான் இருந்தாங்க. டாக்டர்ல இருந்து ஸ்டாஃப்ல இருந்து டெக்னீஷியன்ஸ்ல இருந்து எல்லாருமே லேடிஸ் வந்தாங்க. வந்த உடனே அவங்க முதல் கேள்வி எப்ப இருந்து இப்படி இருக்குன்னு கேட்டாங்க. எனக்கு ஏதோ பதில் சொல்ல ஆரம்பிக்கிறேன், பட் எனக்கு ஐ couldn't and I was sinking. So they started the routines and BP was somewhere around 90/40 and PF ratio ABG பண்ணாங்க. ABG was somewhere around PF ratio was only 118. So they were discussing like contemplating on putting me on ventilator initially. அது மட்டும் தெளிவா I said no point I want to get into the ventilator right away. Please do something else. அது மட்டும்தான் எனக்கு ஞாபகம் இருக்கு இப்போதைக்கு. அப்பவும் அப்படிதான் இருந்தது. லைக் அதுக்கப்புறம் ஒரு நியர்லி ஒரு half an hour to 45 minutesக்கு probably I was totally dazed and I didn't know what was happening. And when I woke up, it was like they have got things ready for NIV and I was on a NIV and but I wasn't feeling that okay. Still on the difficulty and what all we could say that it was like going into a dark tunnel bangala and mari oru feel enna nadakudune therilla thirumba varuvamanum puriyala. It was like totally unexplainable experience in dhan sollanum. I could feel that it was a very close call and I came out of the clutches அப்படிங்கிறது வந்து it's really a miracle. So NIV, it was really a 5-day stay in ICU. It had its own ups and downs and all that I can put across in one single word was it was terrible. But with all this, there were people around who were more or rather damn sick than me, and at least 1 or 2 were wheeled out dead almost every day. And அதெல்லாம் பார்க்க பயம் இருக்கு அப்படினாலும் all along I didn't leave the hope. Hope was burning like desire in me, and I was not ready to give up at all. At every single point, like I kept saying to me, I'm going to be okay. And I kept அதுக்கு கொஞ்ச நாள் முன்னதான் கிரியா அந்த பிரீதிங் எக்ஸசைசஸ்லாம் பண்ண ஆரம்பிச்சிருந்தோம். மஞ்சுளா மேடம் சொன்ன மாதிரி கொரோனா அந்த லாக்டவுன் ஆரம்பிச்ச பீரியட்ல நடந்த நல்ல விஷயத்துல அதுவும் ஒன்று. So I kept on continuing my breathing exercises despite being on the ventilator. And only other thing that was there was music. Though I was on NIV, I was conscious. So my earphones are on continuously and music அதை தாண்டி breathing exercise இதுதான் மாறி மாறி ஓடிட்டு இருந்தது. They will give a time out like day 1 first 24 to 36 hours they couldn't pull me out of the NIV support at all. Further they said probably ஒரு 10 minutes break every 6 hours அந்த மாதிரி கொடுப்போம், அந்த டைம்ல நீங்க வேணா ஃபோன்ல பேசிக்கலாம்னு சொல்லிட்டு. ஸோ அந்த மாதிரி டைம்ல I used to call Narmada and talk to her. அதை தவிர வேற எதுவும் வெளி உலகத்துக்கு பெருசா டச் இருக்காது. பட் அஃப்கோர்ஸ் வாட்ஸ்அப் வாஸ் தேர். ஐ வாஸ் கான்ஸ்டன்ட்லி ஆன் வாட்ஸ்அப். ஃபார் மெனி பீப்புள் தே டோன்ட் ஈவன் நோ தட் ஐ காட் அட்மிட்டட் இன் த ஹாஸ்பிட்டல் பிகாஸ் my I have a set of people to whom I wish every day because அவங்களும் ரெகுலரா விஷ் பண்றவங்க, மார்னிங் குட் மார்னிங் மெசேஜ் அனுப்புறவங்கனால அவங்க எல்லாத்துக்குமே நான் யூஸ்வலி ரெஸ்பாண்ட். ஸோ ஒரு நாள் கூட அதெல்லாம் மிஸ் பண்ணவே இல்லை எக்ஸப்ட் த இனிஷியல் ஃபர்ஸ்ட் டே ஆஃப் ICU wherein I was totally not in my sense at all. So when this was going on, there was what to say, and few people who would have gone through my poem about what I went through in ICU when I wrote it in Facebook might know like ஒவ்வொரு டெத்துமே அங்க வந்து ஒரு பயம்தான். அங்க அந்த பேய் படத்துல எல்லாம் காட்டுற மாதிரி அடுத்து யாரு அப்படிங்கிற மாதிரி ஒரு ஃபீல் மனசுக்குள்ள ஓடுறத வந்து தவிர்க்கவே முடியல. Though I was a die-hard optimist, there was one single ஒரு இழையோடுற பயம்பாங்கல்ல, அந்த பயம் வந்து உள்ளூர போயிட்டே தான் இருந்தது. பட் many things kept probably the hope alive. அதுல ஒண்ணு அப்படின்னு பாத்தீங்கன்னா, as I said, the love from people. There were constant calls which I couldn't take because they didn't know probably I was hooked onto a ventilator and all that. I just kept messaging them that I can't talk and but அளவே இல்லை. அந்த அளவுக்கு ஒரு இனாமஸ் ஓஷன் ஆஃப் லவ்ல தான் நான் ஐ வாஸ் ப்ராபப்ளி ஃப்ளோட்டிங், and that is what actually probably brought me to the shore too. So I don't know why the slides aren't changing. So the faith and prayer, though both are invisible, they make impossible things possible. This is a quote I would love to put it up here, because this is what actually was the reason behind me coming out of the hospital. The faith I had and the prayers and the faith in their prayers that people had. This was probably that brought me out. Actually, this is exactly what I wanted to convey. If your tongue is positive, the world will love you, they say. And I should say thank you, world, because I was something like this. And it is their love, their prayer, their messages, everything that was probably infusing life into me. Apart from medicine, what was given by the doctors, these were playing a major role in me pulling out. These are pictures of few of what to say, my well-wishers from all over. There are enormous pics and videos which if at all நான் வந்து இதுல போடணும்னா அவ்வளோ இருக்கு. Just to say thanks to these little kids, I wanted to bring up these because இதெல்லாம் வந்து நான் ரெகுலரா போற ஹோம்ல, ஆர்ஃபனேஜஸ், and then கோயில்ல அன்னதானம் அது இதுன்னு லைக் so there are umpteen people I want to say thanks. I steal this opportunity to probably tell them that I owe you, I'm indebted, and I'll definitely pay back with lot more love. Narmada and Raghav were there as a solid support all through, and that is one perhaps the prime reason for me to pull out myself from the clutches of this dreaded virus. So this is one thing I want to tell people who get into a similar situation. At any point, keep the worries away. Be a real warrior. You will have to fight it out. This virus is not something that what people joke about, or those who have undergone the real pain of it will know what it does to you. You're literally drained out. You have nothing to fight, but despite you got to fight. So more than the COVID being the disease, fear is the disease. So it's really a dreaded disease, and you'll have to win against all odds, and it can happen only if you keep the fear away. Choose courage. That's what helps you. Get driven by the courage, and let fear be just a reaction, and courage should be the decision that you come out with. Being fearless gives enormous power, actually. This is one quote, once again, which I love even before COVID. When you can't control what's happening, challenge yourself to control the way you respond. That's where your power is. So definitely this is a situation which you can definitely can't have any control upon. But the way you respond to it, unless you have a control, you are going to lose the war. That is for sure. So even in this adversity, you will have to probably bloom. You'll have to bloom with grace so that the disease is actually having a fear to stay with you. You will have to be definitely having only positive expectations. That's what we call as hope. Have only positive expectations. Nothing negative is allowed. Once you get into that, it's a real what they say, ஒரு சுழல். நெகட்டிவிட்டிக்குள்ள போயிட்டோம் அப்படின்னா அது சுத்தி இழுத்துட்டு போக ஆரம்பிச்சதுன்னா it's very difficult to come out of its clutches actually. You really need to go through a lot when you get affected by the disease per se, but something will definitely grow from you when you go through this, and you will be finding a new you who will live more and who will love more. All said and done, as a good doc, I'll have to say, try by all means to be absolutely preventive. That is the best way to fight this disease. But unfortunately, if you fall a victim, don't get deterred by that. Don't get victimized by that. Stay strong, stay courageous, and fight it out. You'll have to fight it out with real vigor. And after all, it is your life and only you can fight it out. Everyone else can pray for you, but the fight has to be from you and you alone. So, yes, it is pretty gloomy out there, but we as doctors should strive hard and work towards a corona-free atmosphere. And I'm looking forward to see you all there. அன்றும் இன்றும் என்றும் அடுத்த நிமிடத்தை கூட நம்மால் ஆள முடியாது என்பதே நிஜம். இதில் தேவையற்ற திமிர், வெறுப்பு, ஆணவம் போன்ற குப்பைகளை சுமந்து சாக வேண்டாம். அன்பு செய்வோம், அன்பு மட்டுமே செய்வோம். நன்றி. ஜெய் ஹிந்த்.
I want to speak.
Thank you, sir. It was an awesome narration of your horrible experience, which is put in your style, which is what I wanted from you. Exactly, நீங்க என்ன சொல்ல வந்தீங்களோ அது கேட்கறவங்க எல்லாருமே புரிஞ்சிருக்கும்னு நினைக்கிறேன். Which will have a positive impact on people. That is what the CME is about. Thank you, sir. It's a nice presentation.
Thank you so much.
Past State President Dr. Krishnan sir wanted to speak.
Yeah.
Dr. Krishnan.
You can unmic.
Yeah,
we can hear, sir. Already unmuted, sir.
Okay, sir. Thank you. First of all, let me thank the Vellore IMA with which I am having 3 or 4 decades of association. Thank you. I had a wonderful evening tonight. I really enjoyed it. First of all, from the second speaker, I read about Dr. Ashoka the Great, but now I heard about Ashok the Great. It's a really terrific journey through COVID. I myself was really in agony when I listened to him. So God is great. So let God be with Ashok and Narmada. Then second thing about I'm not a government baiter. Madam Manjula Devi was talking about so many things. I mainly blame the media and the government for the fear psychosis, the stigma created by the corona invasion. Because of more media, this thing, people got scared. Even the first demise of our doctor from Nellore, they said he cannot be buried here, or his body was thrown out sometime, and from cemetery to cemetery they have been taking it. So it's all because of the government speaking much about the corona. I think that can be covered by the government. As you are telling, only the WHO and the IMC, ICMR, these things should be heard. So that's my request. And I'm sure you people will take it up. Vellore people are very great people. That's my second home like that. Sadagoban, Damu, Nandini, and so many people are there. And I thank all of you. Thank you very much.
Thank you, sir. We have some questions for Dr. Manjula and Dr. Ashok. Dr. Manjula, Dr. Balachandran wanted to know how do we maintain ourselves positive when we have back-to-back COVID duty? I'll get the exact question. How to reduce stress among the COVID duty doctors who are frequently posted in COVID ward, especially non-specialists in COVID duty?
Yes, sir. Bala, sir, I can understand the pain, what you people are undergoing. But as such, COVID, we all know that there is no particular treatment, and only thing what we need to do is we do not have any other choice. We have to keep updating ourselves so that we come to in terms. And as our sir, Dr. Ashok sir had said, if the level A and the level 1, level 2, and maybe we are being posted at level 1 where it becomes easy for us to concentrate. And this is a time, and you people are all COVID warriors. We need to do that, sir. And you can spend the remaining time in updating our knowledge, and then practicing simple exercises as what I told, and getting too much into, I think maybe reading religious books could be of some help in the time of quarantine, where we are posted for 1 week and we are quarantined for another week. Maybe this could be help to stress out, sir. Thank you so much for the question, sir.
Ma'am, thank you for answering. Because Bala sir, the people whom I have interacted in government side are very much worried about this. Each of their COVID duty, and in fact, this talk, myself and Dr. Madan sir mainly felt that people needed it so that they get confidence, or they become stress-free at least while doing for the duty. And the next is for Dr. Ashok, but I feel it is more for me and Dr. Madan and Dr. Gomathi, because the question is whether we should have started antiviral in the first 2 days itself instead of waiting for symptoms to aggravate. So that is like $1 million question, but I will leave Ashok to answer for it.
Definitely, it's $1 million question. And this is what we have been asking the doctors who were attending me right from day one. When my fever didn't come down, we were pressing upon to start upon remdesivir and other supportive drugs, which they said unless you have some other issue like your saturation is going to dip or something else, we are not usually by protocol starting that. And CMC, as we know, they stand by protocols. So we couldn't do much, but still that question is live in me and anybody else who was there with me. Yeah, definitely it could have made a difference, but we don't know.
No.
Actually, myself and Dr. Gomathi were instructing Dr. Narmada to tell the CMC officials to start on remdesivir as soon as possible. When we saw that chest CT, we are sure that it is the COVID and it is going to infiltrate more. So we were worried that you shouldn't develop more symptoms. But ironically, the CMC protocol is different. When you develop symptoms, they try giving all the medicines. So I don't know where to cross the line and where to cross the limit.
In fact, he was almost sleeping himself and having terrible body pain for the first 2 days. I was pressing upon the pulmonology professor, but he was insisting that they go only according to the protocol. Then suddenly at 1:30 night, I called. They said he's been shifted to IMCU on the first day. The next day, 1:30, 2 o'clock, I'm calling. They're saying he's in ICU. Like every 4 hours, he was getting updated. Still, the deterioration was so fast. In fact, I became so friendly with the nighttime telephone person. So she used to immediately connect my call to the ICU. But I would say the phenomenal support system CMC had for updating the attenders, like they really did a lot of work. They really kept us updated. I think that is one of the part, Dr. Manjula ma'am, I really feel more than the people who are involved in COVID, it is the bystanders, the families who don't get to see them. It's more terrifying from the other side of it. We don't know really what is actually happening, and for fortunate enough, Dr. Gomathi ma'am helped me to get the updates, and Dr. Madan got the updates every 1 hour for me. But I don't know about the other people. So I think that is one of the very terrifying aspect of this disease, where you really leave them and come. In other diseases, you stand by them, you know what is happening. In this disease, you really don't know. And it was 7 days of terrible agony. I know that I can't even define that word. So I think stress buster and this talk should be more for the attenders rather than for the person as well. Okay, so we'll audio is low for me. Anything else, any comments any seniors want to put in? And we should follow a stratified treatment and a step-fied treatment. Yes, madam, I think that is something, CMC is far ahead with this. One of the things we found out was AIMS protocol and CMC protocol was almost equal in the world and they were following it, but still those 2 days, and you are not seen by consultants, you are initially seen by the others, and then as Balachandra sir clearly told, seeing non-specialist in COVID, no, I get that fear, and maybe the decisions are also delayed because of that. We don't know. We have to revise our protocols. Anything else? Any comments or anybody wants to interact? Sir?
Hello.
Yes, sir.
I am Dr. Arunachalam from Nagarkoil.
Sir, vanakkam, sir.
I like to congratulate Dr. Ashok for the wonderful narration he had and the sufferings he had in the hospital, and he has overcome everything. I like to ask him whether do you have any symptoms after discharge? Are you taking any medicines now? For Ashok.
Yeah, sir. Thanks for the appreciation. And actually, as per protocol for the next 15 days after discharge, they actually ask you to continue on steroids, sir. Adu thavara vera edum major medications tharadilla. Steroids mattum they asked me to continue for 15 days.
How
and
much,
actually
sir?
now, pardon, sir?
You are taking methylprednisolone?
Methylprednisolone, they put me on 16 milligram twice a day. So 32 milligram per day I was on for 15 days and then tapered and stopped.
Along with other vitamins and other antibiotics.
Actually, CMC protocol and pathina, they don't like ivermectin, vitamin C, zinc, edume, they don't usually advocate, sir. But on my own, I have been taking all that because they didn't say no for that. But as per their protocol, they don't give it in a prescription. They gave only this with PPI, which I was continuing for 15 days. Along with these medications, I was taking on my own the vitamin supports alone.
You were taking the blood thinners, no?
Yeah, blood thinners, like once again, that was on our own. Our physician friends actually advised us to be on blood thinners also. Earlier, they had us on low molecular weight heparins as injectables. Adukapram we continued with for another 1 month as a oral drug because most of our physician friends actually advise it's better you continue that. But from CMC, the prescription was only 2 drugs and paracetamol SOS. That's it. Symptom-wise, where major issues sir, except for probably even climbing stairs were a little difficult for the initial 2 weeks. கொஞ்சம் அதெல்லாம் மூச்சு வாங்குச்சு அந்த மாதிரி குளிச்சுட்டு வந்தா கூட ஒரு 10 minutes ஆவது ரெஸ்ட் எடுக்கணுங்கிற மாதிரி it was so difficult to manage. அதெல்லாம் இருந்தது for the first 2 weeks, but slowly it settled down. Now it's almost more than 1.5-2 months since we came out of the hospital. இப்போ எதுவும் பெருசா issues இல்ல சார்.
Are you doing any grace of God? Ashok, are you doing any exercise? Are you doing any exercise?
I've started the basic exercises alone, sir. You know, extensive edum panna arambikla. They advocated it's better not to for first 3 months. Actually, 6 weeks kalichu CMC by their pulmonology la vandu they are conducting a study, so they enrolled us for the study. So spirometric alla vara solliranga 3 weeks, I mean 6 weeks kalichu we did all that. Everything seems to be within normal limits, but despite they have advised or 3 months ku vandu strainful activities edume vendan solliranga. So basic exercises thavara vera edum na ippodikku padiya mari pandradilla sir.
Antibody test, did you have antibody test?
Yeah sir, panniyachu sir.
Yeah,
it's around 120 irukku sir value.
Okay. The serum ferritin and D-dimer, they have done it and it was
it was all positive, sir. Though it was not highly positive, all these were positive right from the second day fever annike ellame kalaila pannanga. But despite they didn't start on drugs, they waited until the saturation dipped and then only they started me on remdesivir. Level 2 care shift பண்றதுக்கு முன்ன they started on, and level 2 they were continuing that. And
remdesivir they gave 5 days.
Yeah, 5 days, sir. 10 doses.
Congratulations, sir, for and best wishes for your future life.
Thank you so much, sir. Thank you so much, sir.
One question on any follow-up to prevent fibrosis. I think any physician there in the group can answer this, or Dr. Ashok can take the question.
I am not aware of anything that probably post-COVID la enna varum adha eppadi avoid pandrathu ellame. It's once again another $1 million question. So we are just keeping our fingers crossed and praying that we don't get into anything of that sort. That's the max we are able to do.
One thing CMC just started was an early non-invasive ventilation. So that was a part of the study they are taking up, and it has been very successful than waiting for the invasive ventilation. So initially, before Dr. Ashok was there, invasive ventilation, they used to give 15 liters or go for high frequency. From him, they started on non-invasive ventilation much quicker. So that is one of the protocol that is really helping to prevent lung damage. And that is what the study is about now, that they are following people who have been started on early non-invasive to have a follow-up at 6 weeks and 6 months to see the impact of pulmonary fibrosis. So they have certain strict criteria. Then when I got subsequently secondary infection and my saturations dipped, they never advised even to come for any of the non-invasive ventilation too. They have certain strict criteria to do that. But once they follow it, early initiation of non-invasive ventilation helps those patients. So any other physicians can add on to this. I think COVID people who are working in government setup will have more. One person wants to know, how do you look life at now, and what seems to be more important in life now post-COVID? Dr. RGS.
As I told during the talk, sir, it's people, nothing else. Always that should be probably the prime thing in your life. The love from people, the way you reciprocate, definitely it's going to change post-COVID, no doubt about that. Though I'm always a person who loves people and otherwise a romantic guy too. This infection has put a lot of, as I told you, a lot of life and a lot of love into me.
Yeah, Arul Pari's was prayer every day, the Music Society praying every day at 8 o'clock, all that really, that's
that should be a special mention. Actually, I wanted to, probably I missed out very badly on that. Actually, the Music Society of our Vellore Medical Association and my classmates, the batch of 89 of Coimbatore Medical College, they had group prayers at specific time every day. They were so sincere with that, and they continued that almost until I came out of the hospital. As I told, actually நான் வந்து ஒரு சில நேம்ஸோ எதுவுமே மென்ஷன் பண்ணாம நான் போனதுக்கு காரணம் வந்து it's a very very huge list, and as I told, it's going to take hours together if at all I want to list it out. இவங்க அவங்கன்னு இல்லை, there are so many people from our own association and classmates, and as I told, patients. எவ்வளவோ பேர், they were like literally in tears, and I really don't know whether I am really worth it, but thanks a lot. Once again, I'm stealing the opportunity to say that. Thank you.
Balachandra sir has commented, many doctors in government are becoming positive and are recovering. There are many untold stories. It is exactly that why Dr. Madan wanted, seeing the emotional trauma of it, he wanted this topic. He's been asking it for nearly 2 months. Is only because when somebody comes and tells out the story, at least, and Dr. Manjula discusses about the consequences or how to deal with pre-COVID, COVID, and post-COVID, then people will be able to come out for help. So that's exactly what you put in the second slide also. Having the colleagues help and talking about it makes us stressless. So Balachandra sir, you can form a group inside that, so we can have a self-help group among us so that we can help our colleagues and for each other. I think, yes, no ma'am, what do you say? Please unmute yourself, madam.
Unmute panninga.
That's true, Narmada. Maybe people, we can share within ourselves what are all the problems to be dealt with, and how boldly we face that and how to overcome that. Maybe that would be of much help.
Because doctors don't reach out to psychiatric help so fast. We don't talk about our stresses. We don't talk about our difficulties. We try to hide behind the patients. We say patient has a reason, and we really don't reach up. When burnout, that is why I bought the burnout as a first when we talking, when I introduced this topic burnout, because we really don't talk about that among ourselves. So it is high time that we form group and we discuss among ourselves so that we don't lose ourselves in this. We might not lose in physical illness, but we are losing ourselves in mental illness. And this being
that is true, Narmada. The thing is, the stigma of psychiatry is not only among the people as such, it's mainly among the doctors, and doctors think that they are very immune to mental problems. It's not so. Everyone are, if you are a human, you need to have a mind. And if you have a mind, definitely you should have problems, though you are a doctor or any human being. So please don't feel bad or feel it's shame on ourselves to go and consult a psychiatrist. It was a stigma long before, but when we doctors ourselves have this stigma, then we cannot go to the people and the population at large saying that we are actually, we feel very bad to speak about mental issues.
No, it's very true, man. It's very true. Like
if that stigma is removed, I think everything becomes easy.
Even a cricket team or a football team has a psychiatrist with them to mentally support them, positively guide them. Even our IMA can take help from people like Manjula ma'am, senior people like Tyagarajan sir, everybody are there. So we can anyway always have an opportunity to have them tell our frustrations and how to get away from what we are doing. All the things is possible with this social media is available. They can just a call away. That's right.
Madan sir, one question sir.
Yes sir. I think Venkat sir பேசுறாரு.
சார் ஜஸ்ட் சார் ஒன்றும் இல்லைங்க. இப்போ பேஷண்ட்ஸ் எப்படி சாட்டிஸ்ஃபை பண்ணுறது, அதுதான் பெரிய கஷ்டமா இருக்குங்க. இப்போ ஓபிடி வராங்க. இப்போ நான் வந்து கோவிட்னால 1 month ஓபிடி போகாமல் இருக்கேன். பட் அப்புறம் போனோம்னா பேஷண்ட்ஸ் லோடு வந்து அதிகமாக இருக்கு. அவங்கள வந்து அப்பாயின்மெண்ட் ரெஸ்ட்ரிக்ட் பண்ணாலும் அவங்க ரொம்ப கோவப்படுறாங்க. நாங்கள் இவ்வளோ தூரம் வரோம், அப்பாயின்மெண்ட் தர மாட்டேங்குது.
It's ultimately your health, sir. It's ultimately your health. You divide your timing. You see that only this time the doctor will be available. Other times doctor will not be available. You limit your patients. If patient is waiting for you, he'll wait. If he's not waiting, it is his job, his destiny to go somewhere else. So you don't worry about patients. You take care of your health. You satisfy with what patients you see.
Okay, sir. Okay.
Have your family behind, sir.
That's very true, sir. That's very true.
We should be assertive at certain points. If this assertiveness is done, you should tell. You should learn to tell no also, sir.
With
a smile, it works.
As you said, BMI is a very big factor. Yes, definitely. Mortality is very high in obese people. I think that is the reason Manjula ma'am was insisting on exercises, yoga for ourselves. We take time for everything, but we don't take time for ourselves. Every day, 45 minutes or 1 hour for ourselves in exercise, even before everybody gets awake, then that should be one way that we can keep our fitness strong. And one other thing is suicidal rates among doctors is very high. Burnout has been very high. It has really increased during this COVID scenario. When in India there is no statistic. As usual, we are relying on Western statistics that has shown a very high incidence of burnout among doctors, especially during the COVID scenario and this post-traumatic. So I think we can form a group where it will be open for counseling for the doctors and even for guiding us when to restrict our practice and how to have a safe practice. Because one person has asked Dr. Sasireka, Dr. Ashok, in spite of preventive measures, what do you think was the source? What is your advice to the doctors for point of prevention?
Actually, ma'am, as you said, preventive measures, we have been pretty careful with. இப்போ என்னோட கேஸில் எடுத்துக்கிட்டிங்கனாலும் ஓபி எல்லாமே யூஸ்வலாக அந்த கம்ப்ளீட் பிபிஇ கிட்டோட தான் பார்த்துட்டு இருந்தோம். தியேட்டர் பொறுத்த வரைக்கும் எல்லா கேசஸ்க்குமே ஐ டூ அ கோவிட் ஸ்க்ரீனிங் அண்ட் தென் ஒன்லி if it is negative, we take up for the surgery. But despite that, I got into the infection. Really, we weren't able to point out what the source could be. But கொஞ்சம் திங்க் பண்ணி பார்க்கும்பொழுது ஒருவேளை ஒரு க்ளோஸ்டு ஓபியா பார்த்துட்டு இருந்தது இதெல்லாம் ஒருவேளை இஷ்யூஸா இருந்திருக்குமோ அப்படிங்கிறது ஒரு தாட் இருந்தனால போஸ்ட் கோவிட் நான் ஓபி ஆரம்பிச்சதுக்கு அப்புறம் the whole hospital we have changed, like we have kept the doors open now, screens mattum potutom for the sake of privacy for the patient. And then actually ella OPD lime engalukku windows irukku, so we have kept the windows open and we have installed a new idum what do you call section air section kaga or unit um pottom. And air purifier room வந்து room குள்ள we have installed now. இதெல்லாம் வந்து just to probably if at all that has to be the only source நாங்க திரும்ப யோசிச்சு பார்த்தா other possibilities. One another thing what they indicated in CMC was அங்க என்ன protocol follow பண்றாங்கன்னா 5 days even if the patient turns out to be COVID negative, they don't operate upon for the next 5 days. They just wait for whether they are developing any other symptoms. It could be a false negative also அப்படிங்கறனால 5 days கழிச்சு தான் they take up for the theater. But private setupல CMCல சொன்னா கேட்பாங்க, private setupல நம்ம அந்த அளவுக்கு 5 நாளைக்கு பேஷண்ட்டை வச்சுட்டு பண்ண முடியுமாங்கிறது இட்ஸ் a big question mark. So theaterலயும் இப்போ வந்து apart from the earlier usage of this 95 face shield இதெல்லாம் பண்ணிட்டு இருந்தது போக இப்போ I have switched over to 3M ஓட அந்த கிளாஸோட இருக்கிற மாதிரி மாஸ்க்கு மாறிட்டோம். ஸோ அதெல்லாம் வந்து ப்ராபப்ளி தியேட்டரில் வந்து இட் மைட் ப்ரிவென்ட் ஃபர்தர் இஷ்யூஸ்னு. பட் டெஃபினெட்லி இதுதான் ரீசன் அப்படின்னு சொல்கிற மாதிரி எதுவும் இல்லை. இதுதான் ப்ரிவென்டிவ் மெஷர் அப்படிங்கன்னு சொல்கிற மாதிரியும் எதுவும் வாட் எவர் இஸ் highly possible we are trying to follow. That's it.
One more thing is staffs are all wearing the disposable aprons for everybody. We have given the thin ones along with screening, effective screening in the trenches, monitored for all the patients who entered the hospital. So that has also been mandatory for disposables for even the front office staffs. It is affordable for everybody. We can use that. So they don't become the source of infection because our staffs are young generation. Like they are still at 20, 25 and they might be asymptomatic. We think always the patients, the asymptomatic people could be our own staff who have got infected. So it is definitely needed that our staffs are also not getting the infection and not become carriers. So effective barrier methods of nursing practices. Almost every 15 days we have class and orientation for the nursing as well as for the non-medical staffs too. So this is maybe one another way we can. But still beyond all that, there is some other thing which we really don't know. Doctor, there is one, Vijay Govindraj sir has given a very, very nice quote to Venkatraman sir, which fits for everybody. You must know is the best, know now. So and again he has raised his hand, probably he wants to
Ma'am, a very good combination of talk today by Manjula ma'am and Ashok sir. Ashok sir is a booster for every doctor. We can all come out. Even if it comes to us, we can come out. Ashok sir is our godfather now. But Manjula ma'am needs a bigger play now. You know why, ma'am? Because there is a doctor in Trichy who's a skull-based surgeon, world-renowned skull-based surgeon, ENT doctor, who acquired this disease now. And he had to literally stay in the hospital and ultimately he couldn't attend his own son's wedding function. He had to see it through Zoom. And he went into depression and he's on antidepressants for the past 4 days. So never ever feel hesitant to talk to our psychiatrist doctors, ma'am. As you were telling, no, ma'am, that social stigma, all that, throw it off now. Let's all throw it. Let's see Ashok sir as our example, and Manjula ma'am is in hand with us. And even any other doctors, don't hesitate to talk to Narmada ma'am or Madan and get the guidance to talk personally to Manjula ma'am also. Because that doctor is such a world famous doctor, ma'am. He calls me up and tells that, Vijay, I am on antipsychotic depressants, man. Tala, I don't know, my son's wedding, I couldn't go. I am really totally pissed off. So there are people who have the best confidence also coming down. So really don't hesitate. This topic is really eye opener. I feel all IMAs can, maybe Narmada ji, you can take it to the state level and make both of them talk. Such a beautiful, Ashok sir has spoken so nicely from the ICU, from outside. Now he's seeing all of us and making us see the different thing of corona. And Manjula ma'am, please guide all of the doctors who are really still, I'm sure there are around 90-80 participants today. In that, you will really receive within 2-3 days, I think, at least for some other doctor, not for them. But please guide all of them, ma'am, because some doctors are really in antidepressants. But never hesitate to take, I'm telling, ma'am. Thanks a lot, Ashok sir. You're great, sir. Very happy, sir.
Sir, Balachandra sir wants to know COVID status now in India. I think everywhere it is increasing and we have started dealing with it.
We're reaching 10 lakh deaths.
I wanted to make a clear point here. We are getting into the second wave. In
Just got the
Kerala,
message now.
7,000 cases registered yesterday. Maharashtra cases are increasing. Coimbatore cases are increasing. In the previous scenario, we were always some 3 weeks to 1 month lag from all these places, what we have told. Kerala first varum appo avanga control பண்ணிடுவாங்க. அப்புறமா பார்த்தா தான் நம்ம Tamil Nadu and other places will rise. So we have to instruct, as an IMA, we have to instruct the other authorities to be on alert for the second wave. Second wave is started and it will come for sure. இதுல வந்து no doubt. Actually, ICMR guidelines முன்னாடி கொடுத்திருந்தபடி prediction படி கூட even in October end and November only the peaking is going to occur அப்படின்னு சொன்னாங்க. The peaking will be in the second wave. So that is my understanding of COVID as of now, what I've dealt with COVID. Any other suggestions, please?
Practitioners, do you have any special advice, madam? I, for one, know one thing. Always please exercise, and we are having endurance challenge for the World Heart Day from IMA Women's Wing. Please post your videos to us, so we will decide who has got the best cardiac. So Dr. Nandini is going to give a talk on diet and exercise, and we have a very interesting talk on music therapy. So for one, please exercise. Manjula ma'am, to you.
So, can you please repeat the question, Narmada?
Yeah, that is advice to practitioners.
Okay. So advice to practitioners, one thing is, your life is more important. Take care of it first. Instead of saying many patients, like what Venkatraman sir said, there are so many patients waiting for us and how do we manage? These are our questions. And first, take time for yourself. Take care of your health. Our life's value is too much. And when we know how to value it, the steps we take will also be good. Do not encourage too many patients in the same sitting. Maybe you can maintain this social distancing even in your clinics or hospitals. As what Dr. Narmada said, people who are coming to us or should also have maintained all this hand washing techniques. You keep a soap available as in the entrance or a hand sanitizer. And as practitioners, we should be very careful. Wear PPE, do not worry on that. It might be too difficult for us to wear the whole time, but take some gap in between. Take all the safety precautions. Do how much you can do. Do not overdo yourselves.
Yeah, Dr. Balachandra, I think this is the same works for the second wave of OPD or second wave and then controlling your OPD. So he's exactly asked to continue OPD in the second wave. I think more precautions from us. Prevention, as Sir Dr. Ashok said, be preventive rather than suffering later. Okay, I think shall we end it is almost 8:30, sir. So thank you so much for the speakers. As Sripriya is not there, I'm taking up the role of giving the vote of thanks. Thank you both the speakers for accepting our invitation immediately. And we had to postpone 2 weeks, but I think it was worth the wait to have an interesting talk. So Dr. Madan, any more to add?
No, I think we have done justice to this CME by having invited two enlightened people who have enlightened us. So I thank everyone who have participated in this webinar from all over Tamil Nadu, and I thank our members who have actively involved in the question and asking questions and feeling free. It's like as if this is not possible on a live live CME also. Like we can see our faces, we can interact, more questions, we talk very fluently. So all those things are possible through webinar. We can have more people from other places also. Maybe in 2 months time, after the second wave has gone, I think we can go back for our regular CMEs in IMA halls where we get to see each other once again. Thank you.
And more so, we are getting a lot of support from our members, which helps us to bring in new topics rather than the routine topics which is being discussed. So we thank you all for the support you have been giving in this entire year and still giving us for us to take on a new and advanced topics for you. Thank you so much. So thanks for joining.
Dr. Bharani ma'am had replied, thank you IMA for postponing this meet for track 2020. Madam, it's our duty to do it because we know how much struggle you have put in for conducting track 2020.
Dr. Bharani and Dr. Avlalan had really worked for this. We really didn't see that date that first time and immediately we pushed.
Thank you, ma'am. It's our duty.
Thank you so much, all of you. Thanks.
Thank you everyone. Good night.